welcome to Viewpoint on Ukraine today, where right now we are joined by Ukraine's Minister of Health, Mr. Alexander Kvitashvili. Mr. Kvitashvili, welcome to the programme.
Thank you for having me.
So you have been in your position now for just a little over 1 year. Can you tell us, what would you say your greatest achievements are in this period?
I think that the biggest achievement is to push the procurement out of the ministry and have, Ukraine spends about 4.5 billion hryvnias, which is roughly about $200 million, on procuring medicines and medical supplies. And we're trying to contract international agencies, including Crown agents, and UNDP and UNICEF to do the procurement for us. And we have achieved it this year. 62% of the public funds for procurement have been pushed out or moved out to those guys, and they're doing procurement right now. And next year, we're hoping that the procurement will be done at 100% by these guys.
So why is it the procurement needs to be done from effectively outsourced to other countries? Is this normal?
That's not outsourcing to other countries. It is normal for many, many other countries. I worked in Georgia before, and UNICEF has been the one who is procuring vaccines for Georgia for years, for 7 or 8 years now. It's a good thing because, you get a very good ratio of price quality, and the most importantly, timing. Ukraine has a serious issue with, or has been having a serious issue with delivering medicines on time. We would like to avoid that next year, and we're pushing the procurement to them.
So close to 500,000 Ukrainians died last year because they did not have access to medicine. So would you say that the procurement of medicine being done by the United Nations Development Programme, UNICEF, etc., would this reduce this problem, or would it stop it altogether?
I would not really link 500,000 deaths to just the procurement or the state programs, but yes, that would reduce the death tremendously because the timing is essential. You can't have gaps in provision of essential medicines, and that's what we're trying to close next year and this year.
So Olga Bogomolets, who is the head of the Parliamentary Health Committee, recently sat where you are sitting now, and she said that the Ministry of Health had around 4 billion hryvnia on their account for buying medicine. This money was spent, however, the medicine never made it to the hospitals. The procurement was done, however, it was done badly. Mrs. Bogomolets went on to say that she wrote several letters to the Ministry of Health asking for information about the buying process so it could be given to the General Prosecutor's Office so they could understand where the money went, and I quote, who stole the money. So would you say this money that was meant to be spent on medicine was being stolen?
Ms. Bogomolets has the understanding of the healthcare at the level of a moth.
A moth?
A moth. A little flying thing.
However, she is the head of the Parliamentary Health Committee.
Unfortunately, she is, and this is really bad. And I am going on the record saying that. She has no clue on what is happening and how is healthcare organized. She's been blocking essential reforms in healthcare for the past 6 months already. And all that she has done for the past 7, 8 months is accuse ministry of wrongdoings. So I can't really comment on that because she sends not just 3 letters, but she has written about 1,000 letters to the ministry on different. The problem, we're trying to push the reform agenda in this country. I have a large group of Ukrainians traveling to Georgia to see what has happened there, just to show them that this is possible. And unfortunately, the committee has not been cooperative at all. At all for the last 6 months. So they're trying to, I believe that she thinks that she's in executive power, not the legislative. And if she wants my position, she can freely have it.
Okay, so where she said who stole the money, you would say that nobody is stealing the money?
I don't know what she's talking about. Usually she says things that makes no sense, so I can't really comment on that.
OK. So up until 2010, you were the Minister of Health in Georgia. Can you tell us, how does the reforms which you helped to enact in that country, how does that reflect on Ukraine? What's your strategy here in this country?
Georgia is a small country, 12 times smaller than Ukraine. But the challenges there were probably even bigger than here, because Georgian healthcare was completely disintegrated and in ruins. What we did there was we built a very targeted social assistance, which included healthcare provision. Healthcare in general, the whole supplier side is private in Georgia. But the state is the largest provider of the services through also private insurance companies. So the country buys insurance through private companies providing health care to the needed people. Oh. Currently, Georgia has universal health care, which is the new government.
So it's available to everyone?
Yes. The new government introduced that. I think it was a little bit too fast to do that, because it requires a lot of money, and Georgia doesn't have that many resources. But private health care, state that pays for it, and people that are covered entirely. This is the model that is perfect. So we're trying to build the same thing in Ukraine.
So this is what you're looking to implement in Ukraine, universal healthcare?
Not necessarily Georgian model, but yes, getting to the universal healthcare, yes.
But you said this is expensive. Does Ukraine have the money to do this?
Ukraine has resources. Ukraine currently has about $2 billion that is, I would say, wasted on supporting the infrastructure of 40 million square meters. What we're doing is subsidizing the existence of buildings, not quality, not service provision, not nothing. Okay. So we have to switch from that to service provision.
So how are you working with your colleagues in Parliament? We've already spoken about one of them, but in a broader sense, how are you working with your colleagues in Parliament to implement this in the country?
Well, I'll tell you, it's an anecdotal thing. We have, on March 31st, I sent all the draft laws that we were preparing to Ms. Bogomolets, and only yesterday they have issued a new version of my laws, let's put it that way, mine, in parentheses, our laws, with slight changes as their own achievement, which is fine. I don't care about that. The thing is, we have to move the country forward. We cannot have the government or the state being the financier, the provider, and the quality check of the medicine. We have to have a split of the purchaser and provider. And yesterday, apparently, the committee, they voted for the alternative laws, which are pretty much rewritten from ours with about 3% of little changes. And, that's a good thing in general.
So these are your plans looking forward. But if we look at today and we talk about some unfortunate realities in the country, the average wage in Ukraine is around $200 a month, which gives most people access or no access to medicine and decent healthcare. Doctors and hospitals, unfortunately, remain corrupt. You are Georgian by birth, not Ukrainian. So how do you find dealing with these problems on a daily basis?
Look, I mean, it's a good question. It's the same thing. It was the same thing in Georgia. And in addition to all those issues, back then, we didn't have money to deal with it. So you have to come up with some kind of good, structured plan to help, because the state cannot help everyone. The state cannot provide equal health care or equal social assistance to all.
Even in Georgia, with universal health care, there would still be differing levels.
Yeah, right. We started with the most vulnerable and built the system from there. Ukraine has about 15.5 million people that receive subsidies of some sort, social assistance, pensions, whatever there is, right? So we have to target those, assuming that those are the guys that cannot afford decent health care. We have to target them. We can't have. Currently, what we have, the system is, we pay for all, for the guys that have nothing and for those that have Bentleys. Okay, this makes no sense, because the guys that have Bentleys, they fly out to Austria to get treatment. But the money is spent equally on everyone.
Okay.
We have to concentrate our limited resources on those that need that the most, and then, make sure that the others have access to healthcare.
So concentrating on the most vulnerable.
That's right.
Right, okay. So can I ask you, what was your reason for coming to Ukraine?
Well, everybody's been asking me that question, including my family, my wife, my parents. I don't know. This is really weird. I mean, I lived in New York in 2008 when I was called in to work in Georgia, and I dropped everything and I went there. I had a very comfortable life in Georgia in 2014. I was actually consulting Ukrainian government and my predecessor, Mr. Musi, on healthcare reforms in Ukraine. And I thought that the life was too slow and not interesting. But seriously,
so for a challenge, really?
It is a challenge. It is a challenge. And, when you are called in and when you are being interviewed by the Prime Minister, the President, and the head of the Parliament for a position, which happened unexpectedly, and when you're offered the position, you cannot say no to this. This is a good thing. I mean, I'm really happy. If I had to go back and make a decision again, I would have done it without even thinking about it.
OK, now we're running quite short on time, and I just have one final question. Earlier this summer, you tendered your resignation. Poroshenko's faction accused you of failing to conduct reforms and requested your resignation, and you gave it to them. However, you are still sat here today, 6-7 months later, as the Minister of Health. Can you tell us how exactly that's happened?
Look, I mean, I can tell you how it happened, but I cannot give you any logical explanation for that. I mean, it's... yes, I tendered my resignation, saying that, look, if you guys don't... I was invited to come and work here. If I'm not fit to do the job, then, I'll leave. And then, I think it was in September, when the Parliament voted 4 times, and they couldn't get enough votes.
So voted 4 times and having you ejected from your position?
Right. And, I joked that I've been rehabilitated 4 times and shut and then... But anyways, look, it doesn't matter. I mean, I've been working since July with the same hours and same efforts.
With the same motivation that you had before tendering your resignation.
Of course, and if I leave this position, I would like to remain in Ukraine, and I would like to push the reform agenda forward.
OK, thank you. That is all we have time for, but thank you very much for joining us today.
Thanks.
You have been watching Viewpoint on Ukraine Today, where we have been joined by Mr. Alexander Kvitashvili, Ukraine's Minister of Health. Thank you for watching.